Good evening. This is All India Radio. I am Valsa Williams and with me is Manoj Singh Rana with the evening news. The headlines. Prime Minister Narendra Modi reviews preparations and operations being undertaken by armed forces in combating COVID-19 pandemic, retired medical personnel being recalled to work in COVID facilities. Centre directs states and union territories to ensure the use of liquid oxygen for medical purposes only. Over 14 crore 19 lakh COVID-19 vaccine doses administered in the country so far. Air India brings 318 oxygen concentrators from the United States. Karnataka imposes 14-day lockdown from 9 p.m. tomorrow in view of rising COVID-19 cases. Assam government decides to close down physical classes up to 8th standard till the 8th of next month. Central government decides to utilize Hajj houses across the country as temporary corona care centres. Polling for 7th phase of assembly elections in West Bengal concludes. 3rd phase of panchayat elections in 20 districts of Uttar Pradesh ends peacefully. China suspends all its cargo flights to India for 15 days. And in IPL cricket, Kolkata Knight Riders wins the toss and chooses to field first. As the number of COVID cases is on the rise again, we appeal to our listeners not to lower their guard, take all precautions and all those above 45 years to get vaccinated without any hesitation. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. And now the news in detail. Prime Minister Narendra Modi today reviewed the work being done by the armed forces in combating COVID-19, including the efforts to enhance medical capacities and utilizing human resources. The Chief of Defence Staff CDS, General Bipin Rawat, called on Mr. Modi and they reviewed the preparations and operations being undertaken by the armed forces to deal with the pandemic. The Chief of Defence Staff briefed the Prime Minister that all medical personnel from the armed forces who have retired or taken premature retirement in the last 2 years are being recalled to work in COVID facilities within proximity of their present place of residence. Other medical officers who retired earlier have also been requested to make their services available for consultation through medical emergency helplines. The Prime Minister was also informed that all medical officers on staff appointments at Command Headquarters, Corps Headquarters, Division Headquarters and similar headquarters of Navy and Air Force will be employed at hospitals. The Chief of Defence Staff informed Mr. Modi that nursing personnel are being employed in large numbers to complement the doctors at the hospitals. The Prime Minister was also briefed that oxygen cylinders available with the armed forces in various establishments will be released for hospitals. The CDS also said they are creating medical facilities in large numbers and where possible, military medical infrastructure will be made available to civilians. Mr. Modi also reviewed the operations being undertaken by the Indian Air Force to transport oxygen and other essentials in India and abroad. The Prime Minister also discussed with the CDS that Kendriya and Rajya Sainik welfare boards and officers posted in various headquarters in veterans' cells may be instructed to coordinate the services of veterans to extend the reach to the maximum extent possible, including in remote areas.
The Centre has directed states and union territories to ensure that liquid oxygen is exclusively used for medical purposes only. The exception to 9 industries given earlier has also been curtailed to only 3 industrial sectors, including manufacturers of ampoules and vials, the pharma industry and defence forces. The decision has been taken to enhance availability of medical oxygen in the country. Union Home Secretary and Chairman National Executive Committee Ajay Bhalla has written to Chief Secretaries of States and administrators of union territories in this regard. Mr. Bhalla has asked all manufacturing units to maximize their production of liquid oxygen and make it available to the government for the use of medical purposes only with immediate effect until further orders. All stocks of liquid oxygen should also be made available to the government for the use of medical purposes. The Ministry of Steel has said that over 3,130 metric tons of liquid medical oxygen were supplied by steel plants to various states yesterday. It said that steel plants have been able to enhance the supply of liquid medical oxygen by taking various initiatives. This includes reduction in the production of nitrogen and argon and production of only liquid medical oxygen in most of the plants. The ministry said through continuous engagement with steel producers, the safety stock of liquid medical oxygen of steel plants has been reduced to 0.5 days instead of the earlier 3.5 days.
In a bid to address the challenges arising due to the COVID-19 pandemic, Empowered Group 3, chaired by Niti Aayog CEO Amitabh Kant, today reached out to more than 1 lakh civil society organizations, CSOs, to deliberate on coordinated strategies to navigate through the impact of the recent surge in COVID cases. Members of NGOs or CSOs were informed of the recent initiatives taken by the government, like waiver of import duties on oxygen and related equipment, opening up of vaccination for 18-plus population, providing free food grains for 80 crore people for 2 months, and resolving logistical bottlenecks. Mr. Kant appreciated and thanked the civil society organizations for their efforts in combating COVID-19 in India and requested for continued support and efforts in managing the COVID-19 infections in the second wave. He urged them to reach out to people with awareness campaigns which can be downloaded in regional languages and made available from indiafightscovid.com to dispel common myths and provide accurate information regarding COVID vaccination. The Centre has urged all states and union territories to direct authorities regarding implementation of containment framework as advised by the Health Ministry to flatten the curve. In his letter to Chief Secretaries, Union Home Secretary Ajay Bhalla said, in the recent past, a sharp increase in COVID-19 cases has been observed, along with high positivity rate. He said, considering this unprecedented surge, there is an urgent need for states and union territories to consider strict COVID management and control measures in the surge areas to bring the situation under control. Mr. Bhalla also advised that orders issued by the state governments, UT administrations and district authorities for imposing restrictions should be widely disseminated to the public and to the field functionaries for their effective implementation.
The Centre has set up a COVID-19 help desk to monitor and swiftly resolve issues arising in the international trade. For timely support and information on import and export queries, the trade community can access the help desk. Informing about the decision, Union Commerce and Industry Minister Piyush Goyal said that the help desk will monitor the status of exports and imports and difficulties being faced by trade stakeholders in view of the surge of COVID-19 cases. The EXIM community can submit information on the DGFT website, dgft.gov.in, to get quick and timely resolution to their issues. The government today said more than 14 crore 19 lakh vaccine doses have been administered in the country till now. Nearly 93 lakh healthcare workers have been administered the first dose of vaccine and over 60 lakh have received the second dose. Briefing the media in New Delhi, Joint Secretary in the Health Ministry, Love Agrawal, said over 1 crore 19 lakh frontline workers have received the first dose and over 63 lakh have received the second dose. He informed that over 9 crore 79 lakh people aged 45 years and above have received the first dose and over 1 crore people have got the second dose. Mr. Agrawal said the management of COVID-19 across states and districts to follow 3 main principles: containment, clinical management and community engagement.
जरूरत है कि जो केसेस जिनको की हॉस्पिटलाइजेशन की जरूरत हो उनको स्टेट्स के साथ कोऑर्डिनेट करके हम सीमलेस हॉस्पिटलाइजेशन को कोशिश करें ताकि पेशेंट को टाइम पर एडमिशन मिल सके। इसके लिए हमने स्टेट से और डिस्ट्रिक्ट से भी रिक्वेस्ट की है कि हर स्टेट और डिस्ट्रिक्ट गवर्नमेंट ऑफ इंडिया की रिक्वेस्ट के तहत एक डैशबोर्ड प्रोवाइड करे जहां पर की अवेलेबिलिटी ऑफ बेड्स उसको डिस्प्ले किया जाए ताकि लोगों में अननेसेसरी भय का वातावरण पैदा ना हो और एक ट्रांसपेरेंट प्रोसेस किया जाए, क्रिएट किया जाए जिससे कि हॉस्पिटल में बेड उनको मिल सके। साथ ही जरूरी है कि स्टेट्स और डिस्ट्रिक्ट मिलकर बेस्ड ऑन द केसेस ट्रेजेक्ट्री, किस टाइप के केसेस आ रहे हैं, कितनी तादाद में केसेस आ रहे हैं, उसको देखते हुए जरूरत पड़े तो एडिशनल गवर्नमेंट और प्राइवेट सेक्टर के हॉस्पिटल्स के बेड्स को कोविड डेडिकेटेड बेड्स में कन्वर्ट करे और अधिक जरूरत हो तो मेकशिफ्ट टेम्परेरी हॉस्पिटल्स भी बनाकर इंश्योर करे कि जिन लोगों को बेड्स की जरूरत है उनको हम समय पर बेड दिला पाएं।
He said research has shown if no physical distancing measures are followed, one person can infect 406 people in 30 days. Additional Secretary in the Home Ministry, Piyush Goyal, said India has enough medical oxygen available. He said the transportation of oxygen tankers is a major challenge. Mr. Goyal said India is ordering oxygen tankers from abroad on a purchase or hiring basis. Director AIIMS New Delhi, Dr. Randeep Guleria, said we have to reduce the number of cases and use hospital resources optimally. He said the judicious use of oxygen is very important. Dr. Guleria said right now there is unnecessary panic.
अभी अगर हम देखें तो एक अननेसेसरी पैनिक है सब लोगों में और उस पैनिक के कारण इट इज कॉजिंग मोर हार्म देन गुड। तो कोई सिम्टम नहीं हो उसमें ये पैनिक सिचुएशन हो जाती है कि कहीं मेरे को बाद में ऑक्सीजन की जरूरत ना पड़े तो मैं अभी जाके एडमिट हो जाता हूँ। जो जेन्युइन पेशेंट्स हैं वो सफर करते हैं क्योंकि उनको प्रॉपर ट्रीटमेंट नहीं मिल पाती। लोग घर पे दवाइयां स्टोर करने लग जाते हैं और अननेसेसरी शॉर्टेज ऑफ एसेंशियल ड्रग्स वो मार्केट में क्रिएट हो रही है। कई दफा ड्रग्स का मिसयूज भी हो जाता है, उनसे साइड इफेक्ट ज्यादा होते हैं और उससे कोई फायदा नहीं होता है। ये सब गलत धारणाएं हैं और यही मैं क्लैरिफाई करना चाहूंगा। ऑक्सीजन एक बहुत इंपॉर्टेंट ट्रीटमेंट स्ट्रैटेजी है कोविड-19 के लिए, लेकिन उसका मिसयूज जो है वो भी एक बहुत इंपॉर्टेंट फैक्टर है। अगर हमारी सैचुरेशन 94, 95, 96 है या उससे ज्यादा है तो उसका ये मतलब है कि अब हमारे ब्लड में ऑक्सीजन है वो सफिशिएंट है और इससे हमें घबराना नहीं चाहिए।
Member Health in Niti Aayog, Dr. V.K. Paul, said we cannot let the pace of COVID-19 vaccination decline in the face of the emerging situation. He said, in fact, vaccination should be escalated.
Civil Aviation Minister Hardeep Singh Puri today said that Air India has brought 318 oxygen concentrators to India on its New York-Delhi flight today. He said all efforts to strengthen India's fight against the pandemic are on. He said, let there be no doubt we will turn the tide. Ambient air contains about 20% oxygen and 78% nitrogen. An oxygen concentrator is a device that takes in ambient air and filters out the nitrogen from it to concentrate the oxygen molecules in the treated mixture. The Delhi government has decided to provide free vaccines to every person aged above 18 years. Addressing a press conference in New Delhi today, Delhi Chief Minister Arvind Kejriwal said the Delhi government has given the approval for purchase of 1,34 lakh doses of vaccines, terming the vaccine as the only solution to tackle the COVID-19 pandemic. The Chief Minister said the government is preparing plans for administration of vaccine doses to the people. Expressing concern over the different pricing of vaccines for the state governments, the Chief Minister urged the vaccine manufacturers to provide the vaccine at 150 rupees per dose. He said one vaccine producer said they will provide vaccines to the state government at 400 rupees per dose, and the second producer said that they will provide at 600 rupees per dose. He said these companies have promised to provide vaccine at 150 rupees per dose to the central government.
The Delhi High Court today said that it was the responsibility of both the central government and the state government to make availability of liquid oxygen for the national capital. The court also added that the allocation plan should be workable. Delhi has been unable to pick up its allocated supply from West Bengal and Odisha so far. The court earlier said that it had asked the centre to look at the possibility of reworking the allocations to reduce the transportation of oxygen. Himachal Pradesh Chief Minister Jairam Thakur, on the request of Delhi Chief Minister Arvind Kejriwal, has agreed to provide emergency supplies of oxygen from Himachal Pradesh to New Delhi as the national capital region is facing acute shortage of oxygen due to the COVID-19 crisis. In a letter written to his counterpart of New Delhi, Chief Minister Jairam Thakur said that the state of Himachal Pradesh is highly concerned about the situation emerging in New Delhi and would extend all possible help to the Delhi government. He said the officers of the Delhi government may contact Additional Director of Industries for arranging the supply of oxygen from the state. Chief Minister of Delhi, Arvind Kejriwal, has expressed his gratitude towards the government of Himachal Pradesh for their generosity.
A ro-ro service carrying 3 tankers loaded with liquid medical oxygen reached Kalamboli in Raigad district of Maharashtra today. The train had left from Hapa in Gujarat yesterday. Green corridor was provided for the faster movement of the Oxygen Express. The medical oxygen is being made available for treatment of COVID-19 patients across the country through Oxygen Express trains run by the Ministry of Railways. The Oxygen Express travelled a distance of 860 kilometres to reach its destination. The tankers carried around 44 tons of liquid medical oxygen. Maharashtra set a record in itself as more than 5 lakh people were vaccinated today. According to a press statement issued by the State Public Health Department, there could be a rise in the final figures of people who have been inoculated today. On the 3rd of April, Maharashtra had set a national record as 4,62,735 people were given shots against COVID-19. Meanwhile, in Mumbai today registered 3,876 new cases of corona, the sharpest fall recorded in the city after more than a month. In another positive development, more than 9,000 patients were discharged from hospitals following their recovery.
The Karnataka government announced lockdown across the state for 14 days starting from 9 p.m. tomorrow. Only essential services would be open from 6 a.m. to 10 a.m. for the next 2 weeks. Chief Minister B.S. Yediyurappa announced this today soon after a cabinet meeting. There would be no public transport in the state and the metro train would not operate in the Bengaluru city. The Chief Minister further said that all industries except manufacturing would remain closed and the garment industry, which hires lakhs of employees in the state, would also remain closed. The Chief Minister said that all agriculture-related activities would be allowed in rural areas. Agricultural markets in cities will function only for a limited period in the morning. Mr. Yediyurappa said the decisions were taken after hectic consultation with an expert committee and ministers during a 3-hour-long cabinet meeting. Karnataka recorded more than 34,000 COVID cases on Sunday, and of which more than 20,000 were from Bengaluru alone. You're listening to the evening news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi reviews preparations and operations being undertaken by armed forces in combating COVID-19 pandemic. Retired medical personnel being recalled to work in COVID facilities. Centre directs states and union territories to ensure the use of liquid medical oxygen for medical purposes only. Over 14 crore 19 lakh COVID-19 vaccine doses administered in the country so far. Air India brings 318 oxygen concentrators from the United States. Karnataka imposes 14-day lockdown from 9 p.m. tomorrow in view of rising COVID-19 cases. Assam government decides to close down physical classes up to 8th standard till the 8th of next month. Central government decides to utilize Hajj houses across the country as temporary corona care centres. Polling for 6th phase of assembly elections in West Bengal concludes. 3rd phase of panchayat elections in 20 districts of Uttar Pradesh ends peacefully. China suspends all its cargo flights to India for 15 days. And in IPL cricket, Kolkata Knight Riders wins the toss and chooses to field first. For quick news updates round the clock, follow us on Twitter at AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Welcome back to the evening news. In Assam, the Education Department has told Deputy Commissioners to shut down physical classes up to 8th standard till the 8th of next month in the state. This order is to be implemented in those districts where a minimum of 100 positive cases have been reported. However, online classes are to be continued for students. Meanwhile, the Public Health Engineering Department is constantly engaging in sanitization works. The Commissioner, Secretary of the PHE Department, Siddharth Singh, told AIR that along with sanitization, the department is also carrying out awareness drive on health and hygiene.
A lot of steps for COVID management have been taken up. Primary amongst them are sanitization of different campuses. The polling stations, when elections were being held, all the polling stations were sanitized and water facility was made available along with toilets. Additionally, under Jal Jeevan Mission, we have provided more than 5 lakh household connections to people so that they don't have to go anywhere and expose themselves to COVID risk last year. And this year, we plan to provide more than 20 lakh house connections to people. Apart from that, we are also doing a lot of IEC awareness generation, interpersonal communication, so that COVID and its importance is known to everyone.
The Madras High Court has asked the Tamil Nadu and Puducherry governments to impose a lockdown on the 1st and 2nd of May. The court told that the government can announce its decision on the 28th of this month so that the public could take sufficient time to complete their provisions by Friday. It has also suggested the government to allow only permitted vehicles for counting of votes and emergency services. The first bench of the Madras High Court, comprising Chief Justice Sanjeev Banerjee and Senthil Kumar Ramamurthy, made the observations while hearing a suo motu plea initiated by the court to check the preparedness of the state and the availability of remdesivir oxygen, ventilators and beds required to handle the second wave of COVID-19.
The Madras High Court on Monday pulled up the Election Commission for allowing political rallies even as the country is battling a deadly second wave of COVID-19. Chief Justice Sanjeev Banerjee reprimanded the Election Commission for failing to ensure COVID-19 norms during rallies. The High Court has directed the Election Commission to hold a consultation with the State Health Secretary and place on record a plan to enforce COVID-19 protocol on counting day by April 30th. The Union Territory of Puducherry has been witnessing a steady increase in COVID infection cases for the last many days. As a measure to control the surge, the administration imposed more restrictions from today. A report.
All the malls, gyms, conference halls, beauty parlors and salons are not allowed to open. Marriage functions with a cap of 50 guests are permitted, but for the funerals, only 25 persons are allowed. In car and autos, 3 persons including driver is permitted. Religious events involving processions or a large gathering are banned. Meanwhile, in the Union Territory, 1,84,975 persons administered COVID vaccine so far. A total number of 747 fresh cases reported today. 515 persons discharged from the hospitals and 10 persons died. At present, 7,510 persons are treated for the infection. Chandra Mohan, AIR News, Puducherry.
The centre has decided to give Hajj houses in different parts of the country to the state governments to utilize them as temporary corona care centres. Minority Affairs Minister Mukhtar Abbas Naqvi today reviewed the status of use of Hajj houses in this regard. He has directed all the state Hajj committees to assist the state governments to utilize the Hajj houses as COVID care centres. The centre has rejected the media reports that it is putting pressure on states to hide the actual data related to COVID-19. In a tweet, Press Information Bureau termed the claim as fake. It clarified that state governments are providing all COVID data independently and central government has no control over it.
China's state-run Sichuan Airlines has suspended all its cargo flights to India for 15 days, causing major disruption to private traders' efforts to procure the much-needed oxygen concentrators and other medical supplies from China. This happened despite Beijing saying that India and China are in communication for COVID-19 assistance to India. The suspension of cargo flights came as a surprise to agents and freight forwarders who are frantically trying to procure the oxygen concentrators from China. More in this report from Beijing.
In a surprising move, Chinese state-owned airlines suspends its freight operations to India, citing surging COVID-19 cases, despite Beijing saying that it wants to assist India in COVID-19 management. Chinese Foreign Ministry spokesperson did not comment on this matter. He said that China is ready to provide support and help to the best of its capabilities if India makes specific demands. Following the decision of Sichuan Airlines to cancel flights, it becomes very challenging to rush the supplies as they have to be rerouted through Singapore and other countries through different airlines, which delays the much-needed supplies. Anshuman Mishra, All India Radio, Beijing.
Prime Minister Narendra Modi today interacted with Prime Minister of Japan Yoshihide Suga over phone. During the interaction, both the leaders discussed progress in various ongoing bilateral initiatives. The two leaders discussed the COVID-19 situation and exchanged views on various regional and global challenges posed by the pandemic.
Over 75% voter turnout was recorded till 5 p.m. in the 7th phase of West Bengal Assembly elections. The polling remained peaceful in all 34 Assembly constituencies. Live monitoring and webcasting of more than 50% of polling stations, including critical and vulnerable polling booths, were done to ensure a safe and secure atmosphere in the polling areas. The Election Commission said the voters set an example of COVID-appropriate behavior in the polling areas by following due protocols of sanitization and social distancing in view of COVID-19 pandemic. Meanwhile, the high-profile election campaign for the 8th and final phase of the Assembly elections concluded this evening. 35 Assembly constituencies spread over 4 districts will go to polls in the 8th and final phase on the 29th of April. The counting of votes will be taken up together on the 2nd of May. Voting for the third phase of Panchayat elections concluded peacefully in 20 districts of Uttar Pradesh. No untoward incident was reported from any place during the voting, barring few sporadic incidents at some places. State Election Commission has made all arrangements for free and fair elections. Higher police and administrative officers visited polling booths in their areas throughout the day to maintain peace and law and order. People, especially the first-time voters, were very enthusiastic in casting their votes. Uttar Pradesh Panchayat elections are being held in 4 phases, while the counting of votes will take place on May the 2nd.
Chloe Zhao, Nomadland, has won the award for Best Picture at the 93rd Academy of Motion Picture Arts and Sciences AMPAS Award today.
And the Oscar goes to Nomadland.
China-born Zhao has become the first woman of color to win Best Director, and a historically diverse group of winners took home awards. Zhao is also only the second woman in Oscar history to win the Academy Award. The Best Actor went to Anthony Hopkins for his performance in the dementia drama The Father. Daniel Kaluuya won the Best Supporting Actor for Judas and Black Messiah. Frances McDormand won the Best Actress for her role in Nomadland. In the IPL cricket, Punjab Super Kings were 93 for 6 in 16.5 overs against Kolkata Knight Riders at the Narendra Modi Stadium in Ahmedabad when reports last came in. Earlier, Kolkata Knight Riders captain Eoin Morgan won the toss and opted to bowl first.
Now let us take a look at the weather forecast for tomorrow. Srinagar will have mainly clear sky. Temperature will hover between 8 and 26 degrees Celsius. Jammu will also have mainly clear sky. Minimum temperature will be 20 degrees while the maximum will be around 36 degrees. Leh is expected to have mainly clear sky. Minimum and maximum temperature will be between -1 and 13 degrees Celsius. Gilgit will have mainly clear sky. The temperature will hover between 7 and 27 degrees Celsius. Muzaffarabad is also likely to have mainly clear sky. Minimum temperature will be 14 degrees, maximum around 34. Dehradun will witness partly cloudy sky with possibility of development of thunder and lightning. The minimum temperature will be 18 degrees, while maximum will be around 37. Chandigarh will have mainly clear sky, with temperature likely to hover between 19 and 37 degrees. National capital Delhi will have mainly clear sky. The temperature will hover between 18 and 41 degrees Celsius. Mumbai will have mainly clear sky. Minimum temperature will be 28 degrees, while maximum is expected around 35. Chennai is expected to have partly cloudy sky. Temperature will vary between 27 and 36 degrees. And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi reviews preparations and operations being undertaken by armed forces in combating COVID-19 pandemic. Retired medical personnel being recalled to work in COVID facilities. Centre directs states and union territories to ensure the use of liquid oxygen for medical purposes only. Over 14 crore 19 lakh COVID-19 vaccine doses administered in the country so far. Air India brings 318 oxygen concentrators from the United States. Karnataka imposes 14-day lockdown from 9 p.m. tomorrow in view of rising COVID-19 cases. Assam government decides to close down physical classes up to 8th standard till the 8th of next month. Central government decides to utilize Hajj houses across the country as temporary Corona care centres. Polling for 7th phase of assembly elections in West Bengal concludes. 3rd phase of Panchayat elections in 20 districts of Uttar Pradesh ends peacefully. China suspends all its cargo flights to India for 15 days. And in IPL cricket, Kolkata Knight Riders wins the toss and chooses to field first. And with that, we end the evening news. Good night.